Hello everyone, welcome to our channel. My name is Zetu. Today I would like to talk about stroke. Stroke is an emergency medical condition. Proper and immediate treatment is crucial so as to avoid the damage and complications that can be caused by stroke. What is stroke? Stroke occurs when the blood supply to the brain is cut off. As a result of that, the brain tissue die. Type of stroke. One, we've got ischemic stroke and we've got hemorrhagic stroke. Ischemic stroke. It occurs when there is a blockage in the blood vessel in the brain. The blockage can be caused by a thrombus or the blockage can be caused by the embolus. Hemorrhagic stroke. Hemorrhagic stroke occurs when the blood vessel ruptures and it starts bleeding. The bleeding goes into the brain tissue and the brain tissue die. What are the warning signs of stroke? Facial numbness or facial drooping. Arm weakness or leg weakness. Disturbance on speech. Blurred vision. Somebody may have a problem in seeing, maybe with one eye or with both eyes. Dizziness. Sudden severe headache. Call for emergency medical help or call for ambulance once you notice this sign to someone who may be a victim of stroke. What is important as well is to think of the word fast. F-A-S-T. F stands for facial drooping. A stands for arm weakness. S stands for speech disturbance and T stands for the time or the onset of the signs of stroke. What are the contributory factors of stroke? High blood pressure or hypertension, diabetes, high cholesterol, family history, history of TIA. And what is TIA? It's a transient ischemic attack or it's a mini stroke. If somebody had this mini stroke, is a candidate of developing a full-blown stroke. Therefore, it's important once they've got that history, it must be noted that they are on treatment because they are exposed to develop a full-blown stroke. How do we diagnose stroke? Once somebody is in the hospital, there is quite a test that will be taken. One, it will be history taking. Two, physical assessment or physical examination. The CT scan will be done so that they can have the pictures of the brain and they will be able to see where is the problem, which part of the brain is affected. Blood work will be done to exclude any blood disorders. There is quite a lot of tests that will be done before the treatment could be started, and that will help the physician to know what treatment, because if it's ischemic stroke, it cannot be treated as the same as hemorrhagic stroke. What is the treatment then that can follow once they've done all the investigations? One, on ischemic stroke, they give medication like clot blasters, the medication that is going to dissolve the clot. But even that one, it depends on patient to patient. Therefore, the medication really differs depending on the patient, whether he's a candidate to get that medication that will dissolve the clot. On hemorrhagic stroke, you'll find that there's swelling, there's a blood clot that is already in the brain, and once the patient is stabilized, the patient may be taken to theater for craniotomy, where they will evacuate the blood clot. When it comes to treatment, is per patient to patient. How can we prevent stroke? That's prevention. If you have got an existing medical condition, work hand in hand with your doctor. The blood pressure, high blood pressure, needs to be controlled. It must be within normal limits. If the patient has got a history of high cholesterol, medication of cholesterol needs to be taken regularly so as to avoid the problem of predisposing that individual to stroke. Alcohol intake, it needs to be moderated because it's one of the contributory factors. Smoking, if possible, quit smoking. If the patient has got a history of high heart disease, the medication must be taken as recommended by the physician. Exercise, because obesity is one of the problem of stroke. Patient must try to do some exercise towards reducing weight. Healthy eating habit. You can try to work on your predisposing factors of stroke, and then you can work hand in hand with your doctor. In summary, if you are noticing that somebody is having of the signs and symptoms of stroke, think of the word FAST. F stands for facial drooping, A stands for arm weakness, S stands for speech disturbance, and T stands for time when the onset of these signs started. In conclusion, let's do our best to protect one another, work hand in hand with our physician or with all our health workers. If you do like this short videos, please subscribe, please share, and please comment so that I will know what we can discuss about. Thank you for all those people that have been supported me on subscribing. Thank you for all the support and love, and continue taking care of ourselves. Thank you for watching. Till next time. Stay safe and stay healthy.